Vegas. This is Tina Drago with Healthy Las Vegas, coming to you live from the Beasley Broadcast Studio, a KDWN channel 720. We're on today to talk about lower extremities amputation prevention program. It's called the LEAP program. And Dr. Rubin's here with Jeanette Long, nurse who is an RN, MSN, and a foot care nurse specialist. Hi, guys.
Hello.
Good morning. How are you guys doing today?
Great.
Great, thank you.
Excellent. So let's talk about diabetes and let's talk about prevention. I know that running our clinic here, First Person Care Clinic, we see a lot of patients that come in with some scabs or blisters on the bottom of their feet, and before they know it, it's too late.
True.
And we find that there's they end up being in and out of the hospital with the uncontrolled diabetes, and then we have a big problem.
The key words of what you just said are many times it's too late. And that's what the LEAP Alliance is all about, Lower Extremity Amputation Prevention. We are a 501c3 nonprofit organization dedicated to finding problems before, diabetic foot problems before they cause ulcers, infections, possible amputations, even death from complications. And we team up with Lions Clubs in Nevada.
I love that organization. They're a great group.
The Lions Clubs are dedicated volunteers. If a person wants to give back, they become a Lion. And Lions have a special focus on preventing blindness. We also have a special focus on diabetes, its prevention, and so forth. And Jeanette, a fellow Lions Club member, Summerlin Lions Club member, is a proud Lion and representing them very well. So together, this is our mission. Let's try to find problems in diabetic feet before they cause serious complications.
So what we hear in the clinic is, I didn't even know I was diabetic. We hear that all the time until it's really, really too late. So let's talk about what people should be looking for. You're a podiatrist. Let's talk about what they really should be looking for in their feet that should give them ideas or clues. And one of the things you mentioned, the blindness or the loss of eyesight, is a side effect of diabetes. And so people don't always get to see what they should be looking for, right? So it's kind of a double
Absolutely.
whammy.
Well, they say that the foot is the mirror of what's happening elsewhere in the body, and in diabetes that can be true too. I know that Jeanette, in her work and her practice, actually in the clinics, having treated feet very recently, and I happen to be retired working with the LEAP Alliance. I mean, I'm sure that Jeanette will agree that you can sometimes look at a foot and get a hint of the fact that there's a complication of diabetes. For example, diabetes frequently causes poor circulation, poor arterial circulation, peripheral artery disease it's called.
So if their ankles start getting puffy easily?
Well, Jeanette, why don't you maybe
jump in there, Jeanette.
Jump in here on one of the things we often talk about, just let me start this off with, one of the things that we look for is a lessening of hair growth, which can mean that there's not enough blood to support hair growth. But to know if there's lessening of hair growth, meaning if you have less hair now on your feet and toes and legs than you did, you have to ask a patient, have you had more hair growth? And I did that once, and the patient said, I really didn't count my hairs, so I can't really tell you. But Jeanette,
I got to tell you, most women would be ecstatic to have less hair growth on their legs and their feet.
But Jeanette can pick up on that one and talk about the real clinical situation of feet and diabetes.
Well, in my practice, I've seen a lot of times when the patients come in and they don't know that they're diabetics, there's usually some kind of wound somewhere on the foot, and
it's not healing well?
No, it's not healing at all. And a lot of times they don't feel it. They don't know it's there. They can't see it.
It's really tricky, isn't it?
Yes.
Because if you can't see it, because your eyesight's starting to diminish, and you think it's old age, but it's really diabetes,
Absolutely.
Or you don't feel it on the bottom of your feet. I have a friend who's, he's 87, right? He'll probably kill me. I think he's 78. But anyways, he was walking on the beach, and he got a shell stuck in his foot, and he couldn't feel it, and he didn't know about it. And he was going to the podiatrist here in town, or not to the podiatrist, to get a mani-pedi. And he was going to get his pedicure, and the lady said, you have something in your foot and it's infected.
Oh, wow.
And that's what began him going to the doctor and finding this all out. And I'm like, are you kidding me? You couldn't feel something jammed into the bottom of your foot?
Unfortunately, that
Big
is
problem.
very common.
Yeah.
That's very common.
So we need a buddy system. So, okay, people, buddy up and have other people look at your feet. It sounds funny, but it's important.
And some of the other people, if I could interject, the key person in the other people is your own physician. The physician that's treating the diabetic patient, keeping them monitored, keeping them in good health with their diabetes. We have a program, we meaning the Leap Alliance and Lions Club, we have a program called Bare Your Souls to Your Doctor. And that really means when you're in there in the examining room, sitting on the table, waiting for the doctor or the nurse practitioner or the physician's assistant to come in, have your shoes and stockings off. Have your feet bare and make sure, if it doesn't just happen, that you get a complete foot exam. Somebody says, well, what does a complete foot exam mean? Well, if somebody's not taking the time to look between each toe for cracking and the possibility of a little athlete's foot that could result in an amputation down the line, it's not complete. So I think to a certain extent, our diabetic patient listeners have to take charge of their health. Yeah. Physicians are busy nowadays. They have loads of obligations for a diabetic, all the way from blood pressure, and sometimes there's not a lot of time to look at feet, but I think the diabetic has to say, doctor, I've bared my souls, please examine my feet thoroughly.
You know, it's funny, I don't think I've ever had a primary care provider look at my feet. Ever.
And that isn't because the primary care provider doesn't want to do that, Tina. Because every primary care provider here in Las Vegas that I know is very special and very competent. And they know that part of the best practices for primary care is examining the feet of their diabetic patients once a year thoroughly. But reality is reality. So that if I could just get a little plug in for a program that the Leap and Lions have now, it's a CFEA program. CFEA meaning Comprehensive Foot Examination Assistant. Mm-hmm. We are, as we speak, in the middle of the first training session for persons with some healthcare background that want to learn how they can work with a primary care physician under the physician's supervision, meaning the physician is somewhere else doing what the physician
so like
has
a medical
to do.
assistant.
Exactly.
Yeah.
Exactly, Tina. That's exactly what it is. But they are trained to go through a 17-point examination of the foot, being able to bring to the doctor a report on what's going on with that foot, whether the doctor has to look at it or not, or order something. And we hope that that's going to improve the number of comprehensive exams now.
So where do we sign up for this class?
Well, let me do
Come on, I want my guys in there.
I didn't bring the sign-up sheet, but for those listening, maybe we piqued your interest. You have somewhat of a healthcare background. You don't have to have a degree. Learning how to talk to a physician about foot problems is not difficult. We have PowerPoint presentations, meetings, teleconferences to get you equipped. Then we certify you, and of course, the chief certifier is on my sitting here in the studio on my left. That's right. So I'm going to give you a telephone number.
Okay,
everybody's
let's hear
got a pencil. Here's the telephone number: 702-702-233-5253.
Say it again.
702-233-5253. And that happens to be my special telephone number for those interested in this program, and I'd be just happy to tell you all about it.
Love it. I love it. So so now we have the issue of preventative. We really, that's a hard one because, okay, people bare your souls. I love that. So then the next step is once we've gotten down the path, if they have an ulcer or a wound or a scab on their foot, is it too late, or is there something we can do to prevent it and get it under control?
No, it's not too late. We do need to be very proactive and keeping it under control with antibiotics, with wound care therapy, to make sure that it doesn't get any worse and spread, so that the patient can keep his
Is there debridement
limbs.
Involved?
Yes.
Ouch. So, yeah. Okay, so get it under control, keep them under control, keep their diabetes levels under control.
Absolutely.
Don't do anything to exacerbate the situation. And antibiotics, which means no drinking.
Right.
So, okay, adults, let's be adults. Take care of your body. We have a gentleman who just came in last week, uninsured, truck driver, who had an ulcer on his heel. And one of the things we do at First Person is we do a whole wraparound. So we got him his insurance. We made sure he got insurance. We made sure that he got to a podiatrist, so he could get to a podiatrist to have the wound care because it had gone beyond what it needed to go, and so that we could save his foot so that he could remain truck driving. You know, I mean, that's his livelihood. So we try to do all that wraparound. So tell us some of the things we should look about toenail clipping. I know like the Blind Center has people come in and clip their toenails because they're blind and this is an issue for them. But what about regular people who are just poor and diabetic and maybe on Medicaid and don't have the money to go to a podiatrist or even to get a pedicure? What do we do with them?
Well, that you bring up a very, very serious problem. In fact, so serious that we call it possible death by long toenails in diabetic patients. The serious problem being mainly in the Medicaid population and in the uninsured, or nowadays we have to say underinsured persons. I have insurance, but I can't afford to pay that large deductible.
You know what? That is so huge because they had insurance because they have to have insurance because it's the law, but they have a $5,000 deductible. So what the heck?
Okay, so here let's talk about Mary. Okay, Mary, hypothetical.
Okay, hi Mary.
Mary, unfortunately, is low income, is on Medicaid. She does have Medicaid. So she's very fortunate.
She has more than most.
She has fortunate, but she's fortunate. But she's unfortunate in the fact that she's diabetic and her eyesight is suffering. She really has difficulty seeing. She has a bad back, so she can't bend so easily because she's 76 years old. Okay,
but she has
and her
Medicare?
Toenails and she has Medicaid.
Okay,
and her toenails are
too
long,
yeah,
and maybe thick and maybe discolored, meaning infection. She can't bend to do anything, and she can't see. Even if she could see well, she would have to get some kind of scissors or something, and that's dangerous. So she lets the nails grow longer and longer. One nail then grows into the flesh of the other. You know, the nail opens a wound, and then we're right at where Jeanette left off. Here you have a wound that has to be dealt with. Now, that wound can be infected, lead to amputation. Complications can lead to death. So saying death by long toenails, that's not just hype. That is possible, and it does happen. So we have a problem, and we're trying to solve it. The Lions of Nevada are trying to solve it. What we're doing right now, the program will be launched very soon, several things. Number one, we are training nail technicians, pedicurists, to work under the supervision of a podiatrist in clinic days. We have let me give them a plug, up in Summerlin, Spiral's Nail and Hair Studio. We have several nail techs that are learning how to cut nails, not only normal nails, but thick nails that you need a little bit of electric grinding, not painful, but accomplishes.
Like a Dremel tool?
Exactly, a Dremel tool. And they're learning how to do this, and there is going to be, and we have free screenings there now, but there's going to be nail care there. And we're hoping to find clinics throughout town that will let the Lions and the Leap Alliance come into their clinics on certain days, certain times, and have toenail cutting clinics.
Ooh, pick me. First Person Care Clinic.
You got it. You got it.
Yes.
Let's rocket this off together.
Absolutely.
And beyond cutting toenails, we want to give what is called routine first care, meaning that if a toenail is cut and there's a corn on that toe that's just about to open into an ulcer, we want that corn cut too. It's called routine foot care. By the way, I will mention this. Medicaid patients who have Medicare primary, they're covered for, if their deductible is met and the co-insurance is met, they're covered for this care. And our doctors, we have a network of doctors as well, and what we're doing, they're going to forgive the deductible and co-insurance if it's a hardship.
Excellent. Now, do you work with like the CareMore centers or the I'm thinking Senior Dimension or Humana, or those organizations that have special diabetes programs within them to help their patients live a longer, healthier life?
One of the key podiatrists in our team is Dr. Denise Tropia. And she is a podiatrist that works very closely with
Humana, Senior Dimension, Caremore?
Caremore.
Caremore, okay.
I know another organization, but the Caremore for sure. And yes.
So don't be afraid to ask people. Don't be afraid to ask your provider for that extra little bit of attention. You're not being pampered. You're actually doing good health care here by having them look at your feet and trim your nail.
Absolutely. Not only don't be afraid to ask, I think you have to just be polite and say, please examine my feet.
It's amazing how the word please can open so many doors.
Before I get off of this table, doctor, will you examine my feet? Because that visit where that patient asks that question is the one visit of all the medical visits that person might have that might save their life.
Right.
Okay, I will. Oh, what's this little tiny sore that you don't feel on the bottom of your foot because you have neuropathy? So that's what might happen. Only good things from that exam.
That's true. You can't be over precautious, and really, a medical exam shouldn't be 5 minutes, especially if you're only going in once or twice a year. If this is an annual, you should be expecting a half-hour minimum if you're in good health to an hour.
Well, you hit the nail on the head. And, that's a campaign we have. We have many Lions Club members ready to go as a brigade, more or less,
I love it.
into the offices of primary care physicians with a sign, which, of course, if we had radio vision, persons
Can we read it? Read it for us.
Yeah, sure. We have a sign. I think it's a pretty nice sign. Jeanette over here donated 100 of them for us to start. It's a sign which has a little stickum on the back. It's meant to go on the walls of primary care physicians' examining rooms. And the sign says, if you have diabetes, please take off your shoes and socks so your feet can be examined. And then there's a little emblem of the Leap Alliance and the Lions Club's emblem as well. So our objective is to visit every possible primary care physician we can in the Valley area, ask them to put these signs in their examining rooms, ask them to give the examination. If their time is very limited, as most are, we'll provide them with an assistant trained to help them do this. And we see no reason why every diabetic in the Valley should not get a preventive foot exam. So, can you imagine the number of amputations we could save?
Oh my gosh!
If we could get this
every
done?
week somebody comes in with an amputation of some sort or another, and it's just disheartening. Tell me something about the Leap Alliance. Is this a local organization or is this national?
What it is about 6 years ago, I, being a retired podiatrist, bored with retirement, and my dear wife, Arlene, who was my office manager and clinical supervisor and do everything because somebody wasn't in the office,
right.
We both knew that there was a tremendous need for diabetics to get their feet examined. So we formed the Leap Alliance about 6 years ago. We're co-founders of the Leap Alliance. And we went directly to our Lions Club and said, hey, we have no employees. We have nobody to get the word out. Will you be trained, become Lion foot soldiers, learn how to test for diabetic neuropathy with a simple little filament? They said, sure, we're on board. And
Isn't that fabulous?
It was fabulous. And now we are, I will tell you one more thing, there is a new Lions Club about to be formed. And your listeners are welcome to find out about this club. It's for physicians, nurse practitioners, diabetics themselves, diabetic educators, all those that want to get together with the mission of spreading the word about getting your feet examined to prevent amputations. It's going to be called the Nevada Diabetes Lions Club.
Excellent.
So I'm going to give my phone number again.
Do it.
702-233-5253. 702-233-5253. Become a Lion. We all serve. There's so much today that didn't exist yesterday even. By yesterday, I don't mean that literally, but
like a week ago.
Even a few years ago, that if you catch a complication of diabetes early enough, you can prevent all that from happening. Now,
Yes.
one of those complications is peripheral artery disease. If your circulation is bad, an ulcer is going to open. And now, one of our members of our team is a vascular surgeon specializing in these new small stents that can be placed into the arteries in the leg, in the ankle, some even close to the foot, to open up the blood supply to the foot so that ulcers won't occur to begin with, and certainly if they are present, will heal.
That's a great advance in technology.
He's an expert in his work.
And who is he?
Dr. Bernstein.
Dr. Bernstein.
Dr. Bernstein.
Thank you.
He is. We're lucky to have him here in Las Vegas. and working with our team.
I am the reason I started this radio show was because I was so sick of Las Vegas being everything bad being number one and everything good being last, just across the nation. It just, being a girl that was, raised here in Vegas, and this is my community and I love it. It really pissed me off, enough to get on my soapbox and say, hey, we have phenomenal people here. We have wonderful providers. We have great educators. And Las Vegas is getting a sham because we grew too fast. Our wonderful providers and our great educators couldn't keep up with the growth. But that doesn't mean we don't have these people here.
Isn't that a good feeling?
Yeah.
And, just to share this with you, just a couple of months ago, I and a few others met with Mayor Carolyn Goodman, and we told her about our program. She's very supportive, and she and the ex-Mayor Goodman have been Lions have been favorites of theirs. They've been very helpful to us in spreading the word about Lionism. Anyway, when we met, I said to her, and she agreed, Las Vegas is the capital of the world in preventive diabetic foot care. No place are there screenings being given throughout town. Is there a network of doctors wanting to help? And so, we could all take pride of our being in the Valley here.
And if you have a diabetic issue and you don't know where to go, you're not looking. The Southern Nevada Health District has a huge program. There's diabetes specialists all over the city. There's pharmacists like DulceRx. We have done this is our 17th show, and I would say at least 4 or 5 of them have been on diabetes, various issues. It being a gateway to other diseases and diagnoses. It's all the prevention that's out there, all the resources that are out there, the education that's out there. The Health Insight has a whole I Do program that they work with, of diabetic specialists. So, and now we have the LEAP Alliance here, and they're out there to help you. These are all resources available. So there's no excuse to really get off your butt and pick up the phone and call somebody and go out there, because they're there. The resources are there, and they're free of charge for the most part.
And you point out something which is a dilemma of sorts. And that is, yes, you're absolutely right. Jeanette's nodding. We all agree. We have a great resources for diabetes here in the Valley. And this program on preventive foot care is one of them. But in many instances, it's a well-kept secret.
Yes, spread the word.
And what's needed more than anything else is media attention to this. And media attention, you being involved with media, we all being involved with media to one extent or another, it does take finances and funds in order to get programs to reach out to the community with what we have available. Print media, radio shows, wonderful radio shows like yours. Appearances
and dance. I have another gentleman has a show on this KDON station as well on Sunday evenings. And he does a great job getting the word out.
Yes, and so I guess what we're saying is the persons listening and all other persons, we need their help to get the word out, but particularly media. They can be great advocates for what we're doing, and we hope to get their cooperation. And one of the things this new Lions Club that's forming is doing is actually fundraising to be able to afford those paid commercials. Hey, get your shoes and socks off in the doctor's office, or something better said than that. Those paid commercials.
I like the bare your soul.
Yeah, that's right. Write up some PSAs, that some of the stations might be able to listen to, and things like that.
So if we had anything else to say as we wrap up this show and tell people to show their feet, show off your feet, people. What can we do? Jeanette, come on, wrap it up for us.
Well, the one thing, my biggest pet peeve is, if you're diabetic, don't think that you're going to lose a limb eventually anyway. That's not the case. I hear that so many times. Well, why should I care? I'm going to lose my foot eventually anyway.
Oh, those people you just want to take like a chicken and choke them.
I do. I do. But that's not the case. You don't have to lose a limb, and that's what Larry and I are here for. That's what we're doing. We're trying to prevent the loss of limbs and life.
Thank you very much. And I have to tell you, my providers, they have their own little competition going on in the clinic. So their A1C in their patient panels. So every week they're checking the A1C of their patient panels, and as they go down, they're like, okay, I'm at 4.2, I'm at 3.7, and so they actually have this friendly competition going on who can get their patients healthier. And I love it because if you're diagnosed with diabetes, you have resources. You have options of getting yourself back healthy again. You don't always have to be taking insulin with a needle. There's things you can do before it gets too late. So you have to stay on top of it and be vigilant. Thank you, Larry Rubin. Dr. Rubin, I should say. Thank you, Jeanette. Thank you very much. This is Leap Alliance, and this is Tina Drago with First Person Care Clinic and Healthy Las Vegas.